Okay, so let's just look at some ingredients for bone growth. Okay, so um, vitamin D. Well, we definitely need vitamin D to absorb calcium from the gastrointestinal tract. Where do we get vitamin D from? Well, we synthesize inactive vitamin D in our skin. Typically only 20 to 30 minutes per day is required of sunshine. The vitamin D is activated in your in your kidney to become active vitamin D called calcitriol. And calcitriol can then can help absorb calcium from your gastrointestinal tract. Okay, so it's a fat-soluble vitamin. It's stored in the liver. Um, we also, of course, get vitamin D not only from sunshine in our skin, but also from dietary sources. Okay, and lack of vitamin D in children will result in a condition relatively uncommon in North America called rickets. Lack of vitamin D in adults, again, relatively uncommon, will result in osteomalacia. Okay, a softening and weakening of the bone. Vitamin C, well, vitamin C is required for the bony matrix. So there's collagen being laid down in bone, and vitamin C is a really important vitamin for collagen formation. Okay, so lack of vitamin C can lead to a condition called scurvy, where you have inadequate and poor soft tissue development. So you can get loose teeth, you can get bleeding gums, you can have easily injured tissue and skin. Um, you can have bruising all over your skin because the blood vessels are so fragile. Okay, so always think of vitamin C as a requirement for normal collagen formation, which is a really big component of soft tissue and also um, uh, in bones as well. Okay, for the for the bone matrix. Calcium and phosphate, well, they mineralize the bones, right? So calcium homeostasis, remember, is with the parathyroid glands, which, uh, if the calcium is low in your bloodstream, parathyroid hormone can be secreted to help reabsorb calcium from the kidneys. Um, it's also going to stimulate more activation of vitamin D to reabsorb calcium from the gastrointestinal tract. And parathyroid hormone um, breaks down bones. It resorbs bones and releases calcium and phosphate into the bloodstream. Okay, so calcium and phosphate really important in bone growth. And lastly, we spoke about a collagen, which is basically in an assortment of tissues in your body. So ligaments, tendons, soft tissue, muscles, bones, and it basically holds the body all together, right? So collagen is extremely important. Okay, so we've spoken about this a bit already, and I know you've probably seen it before, so let's just do it a bit. So the parathyroid glands, which are those four little buttons that we see on the thyroid gland at the top of the image, they're actually on the posterior side of the thyroid gland. And parathyroid hormone is released in the setting of low serum calcium. Okay, so how are we going to get the serum calcium to go back up with parathyroid hormone? On the left, it's going to stimulate the release of calcium and phosphate into the bloodstream. Well, that's going to help calcium go up. It's going to go to the kidney and reabsorb calcium that's in the renal tubules so they don't end up in the urine. And that is going to also help serum calcium go up. It's going to help with activation of vitamin D, which can then go to the gastrointestinal tract and reabsorb more calcium. Okay, so there's 3 ways that parathyroid hormone can actually increase serum calcium. Okay, so let's just talk briefly about calcitonin, which is a hormone that's produced and released by the thyroid gland. And this is a counter-regulatory hormone, so that when calcium is elevated in the bloodstream, calcitonin is released, and it inhibits further calcium secretion or release by the bone. Okay, so it inhibits osteoclast activity by the bones, so that serum calcium can be released. Okay, so it also acts on the kidney and encourages calcium not to be reabsorbed into the bloodstream and end up in the urine. Okay, as well as the gastrointestinal tract, it inhibits calcium absorption from the intestines. So all of these different routes will lower serum calcium. So really, I think of calcitonin as a counter-regulatory hormone when serum calcium is elevated. Okay, so parathyroid hormone tends to elevate serum calcium. Calcitonin lowers serum calcium. In actual fact, one of the therapeutic uses for calcitonin could be used for osteoporosis, okay, to inhibit osteoclast release of calcium. As well, we can use it in vertebral fractures. So if an older person has fallen and they have what's called a compression fracture of their spine, we can give them calcitonin to stop release of calcium from the bones. And also it tends to help the bony pain of a compression fracture of the vertebra. Okay, so that's just a bit of clinical use of calcitonin. Okay, so let's talk about some different types of cartilage tissues. In general, cartilage is avascular, meaning there's no blood supply to feed it nutrients. And because of that, it makes it prone to potential infection if contaminated, and also poor wound healing due to the lack of blood supply. Okay, so cartilage relies on diffusion of nutrients and oxygen from surfaces as opposed from blood supply. Okay, so always think of cartilage as a tissue that's very prone to potential infection or poor wound healing. So there's 3 types of cartilage: hyaline cartilage, elastic cartilage, and fibrous cartilage. So hyaline cartilage, and by the way, they're all made of collagen. Hyaline cartilage would be the most common. And where do we find hyaline cartilage? Well, in the tracheal rings, in the bronchial tubes, in your nose, there's some hyaline cartilage. The epiphyseal plates, those growth plates, have hyaline cartilage. And also the articular surfaces of bones, so the joints, okay, they have hyaline cartilage. So it's nice, smooth cartilage, so very good for joint articulation. Okay. Elastic cartilage contains more elastic fibers along with the collagen, right? So, for example, your ear, which is very flexible, the epiglottis, which is in your larynx and responsible for, well, it acts as a flap that closes off the upper airway when swallowing food in order to avoid aspiration, and the larynx itself. Right? So the larynx has elastic cartilage, so much more flexible. Fibrous collagen, much tougher and dense collagen fibers, and a lot of them act as shock absorbers in the body. So, for example, the intervertebral discs are made up of fibrous cartilage. Insertions of ligaments and tendons into bones, there's often a bit of fibrous cartilage. The meniscus, so the very strong fibrous cartilage that we can find lying within joints, which are called meniscus, are made up of fibrous cartilage. The front part of your pelvic bone, called the pelvic symphysis, where they meet anteriorly, well, they're joined together by fibrous cartilage. So fibrous cartilage tends to be relatively immobile. Because it's so thick and tough. It's not a flexible cartilage that's involved in movement. So when I talk about fibrous cartilage being in a joint, whether it's the hip or the knee, that's the meniscus. That's the part that goes around and acts as a shock absorber within the knee. It's not the smooth hyaline cartilage that articulates. Okay, so if you were to look at a knee joint, and there will be one coming up, you'll see that there's a meniscus, and that will be made up of fibrous cartilage. Okay, so this image is really just showing you different areas of the body that have different cartilage. So I didn't mention that as your ribs come around to the front before they attach to the sternum, well, there's cartilage there, right? So it's not like we have bony ribs that start at the back, curve around to the front, and then just attach to the sternum. No, there's cartilage there as well, okay? And when we're looking at the hip joint on the right, you can see that there's articular cartilage, and the articular cartilage will be hyaline cartilage. And then the hip joint will have a very powerful ring of cartilage around the joint, and that will be made up of fibrous cartilage. So that part acts as a bit of a shock absorber. Okay, so just depending on where in the body we're talking about will determine what type of cartilage there'll be. Okay, so let's move on and talk about joints. And there's 3 types of joints. So the one that we'll typically think of and talk a bit about, a bit more than the others, is synovial joints. There's also cartilaginous joints and fibrous joints, and we'll talk a bit about those as well. So when we think of articulating surfaces of bones, i.e. joints, well, they're covered by cartilage, and they're typically covered by synovial cartilage. Nice and smooth to keep friction down and to allow the joint to move smoothly and with minimal resistance. Okay. Around a synovial joint, such as your knee, or say a finger joint, well, there's a capsule, right, that protects the joint. And within the joint itself, so within the capsule, there's fluid. There's a bit of synovial fluid. And the synovial fluid supplies nutrients and oxygen directly to the cartilage. So it diffuses into the cartilage. Okay? So we'll have an image coming up, but think of the joint capsule as really protecting the joint from injury. Okay. Now, around joints, there's ligaments, and remember, ligaments go from bone to bone, so they strengthen the joint by attaching one bone to another around the joint and giving it a lot of structure and strength. Whereas tendons that are spanning across joints are coming from muscles, right? And they're going to move the joints. Okay, so remember what ligaments are. Remember how they differ from tendons in terms of bone to bone for ligaments, muscle to bone for tendons. Okay, so the three different types of cartilage. Definitely the third one, the synovial cartilage, is going to be the one we're going to talk a bit more about. But the fibrous cartilage, well, that's relatively immobile. So for example, between the sutures of your skull, well, there's fibrous cartilage. Okay, so there's no movement to it. It's just providing strength where there used to be movement as a child. Okay, cartilaginous joints, I would think of the spinal column. So those are joints where between the bones, it's essentially all cartilage. Okay, so the intervertebral discs are basically shock absorbers, and there'll be cartilaginous joints between the vertebral bodies. Okay, and finally, synovial joints. Well, that's typically what we think of as the elbow joint, the shoulder, the hip, the knee, the ankle. They're all going to be synovial joints with a lot of movement. Okay, so at the bottom you'll see that fibrous, it says synarthrosis. So basically it's a fused joint. There's no movement there. Okay. Synovial joints, diarthrosis. There's going to be the most movement at those joints. Okay, so let's look at a synovial joint and its anatomy. So let's just say this is the knee joint, or it could be a finger joint too. They're going to be very similar. Okay, so at the surfaces or at the ends of each bone, so within the joint, there's going to be synovial cartilage. Okay, now there's going to be a joint capsule that completely surrounds the joint itself and gives it protection. And then within the capsule, there's going to be synovial fluid. And the synovial fluid, as I mentioned before, not only gives the joint a bit more protection, a bit more shock absorbing ability, but it also feeds the synovial cartilage with nutrients. Okay, so we would call a synovial joint, such as this one, it has articulating cartilage, right? So they're meeting each other and they're articulating. Okay, and lastly, I just want to mention at the bottom, you're always going to see that saran wrap lining of periosteum around bones, which is filled with blood vessels and nerve endings. Okay, so these are showing you 6 types of movements of joints, and the movement of a joint just depends on which joint we're talking about, right? So if we look at the hip joint, well, that's a ball and socket joint. Okay, the shoulder joint, by the way, is a ball and socket joint. So really, the area of the body has been different areas of the body have been made with different types of joints and allowing them to have certain mobility. Okay, so that's pretty amazing that there's all these different joint movements depending on which part of the body that we're talking about. I'm not going to go through all of these joint movements, but take a look at them and just make a bit of sense in terms of why does it move in this particular fashion. So if I look at the wrist joint, if you move your wrist joint, you can see that it moves in multiple directions. It extends, it flexes, it deviates to each side. So if you look at the term, well, it's a condyloid joint. Does that make sense in terms of the word? Not really. But these are the terms that are used for different joints around the body. Okay, so what are bursa? So I mentioned this earlier in the module, and these are just fluid-filled sacs. So they have a bit of synovial fluid in them, and they're at points of potential friction. So if we're looking at the knee joint here, you can see that there's multiple bursa around the knee joint where there's potential areas of high friction. So at the front of the knee in this image, you can actually see 3 bursa because as your knee is flexing and extending while you're walking, there's potential for the kneecap, the patella, to rub against the femur. So the body has positioned these bursa in areas where there's potential friction and rubbing against ligaments or bones. Okay, you can see that right at the front of your patella, you actually have a bursa on top of your patella, so just below the skin. And if you do a lot of kneeling or a lot of work on your knees, so construction workers, anyone who's having to crawl in small spaces as part of their work, they're going to get bursitis of that bursa because they're compressing and irritating it, and that will lead to bursitis. Okay, so bursitis is inflammation of a bursa, typically because it's being injured or it's being overused. Okay, and they can also get infected. Okay, so think of these as sacs really well positioned around joints to reduce friction. Okay, ligaments and tendons. So both of these are made with very tightly bound collagen. Okay, both of them have poor blood supply, just like cartilage. So when we injure ligaments and tendons, they can take a long time to heal. Okay, so for example, if you go over on your ankle and you stretch ligaments, that can take weeks and weeks and weeks to heal compared to the bone, such as when we're talking about a fracture. Well, fractures usually take 4 to 6 weeks to heal and to have a lot of strength to them, whereas ligamentous injuries can take months to heal, and sometimes they don't actually fully heal. Okay. So what helps with the production of collagen from fibroblasts? Well, vitamin C is needed, which isn't only needed for ligaments and tendons, but it's also needed for collagen production in bones. Okay. Now, I've mentioned this before, so the tendons attach from muscle to bones, right? And they allow joints to move with contraction of muscles. Ligaments, they tend to have a bit more elastic fibers in them, but they're essentially made of collagen, and they attach from bone to bone, giving more strength, for example, across joints. Okay, so if it wasn't for ligaments, your joints would be completely loose. They would have no strength. They would have no give to them. They would just wobble. Okay, so the ligaments really hold joints together strongly. Okay, so here's just a nice example of tendons on the left, right? Attaching the muscle fiber um, to the bone with a tendon on each side of the muscle, okay? And with contraction of the muscle, there will be force through the tendons in order to move the bone across a joint, right? So, and you can get tendonitis from recurrent use of muscles. So say, for example, you decide to paint your entire house one day and you're using just a typical paintbrush and you're just painting for 12 hours. Well, there's a good chance you're going to get tendonitis of some of the tendons in your forearm because they've been pulled on all day by contraction of muscles. Okay, so that's typically how we get tendonitis. How do we get, so on the right, let's just look at ligaments. So ligaments are really just binding the joints and giving them incredible strength. Okay, and how do they get injured? Well, if we look at this image, say for example, you have a fall and one of your fingers gets hyperextended. So nothing's fractured, but you have a swollen finger joint. Why is it swollen? And well, what's happened is the ligaments have become stretched at the joint, and that's going to take time to heal because there's very little blood supply to ligaments and tendons. So the joint will become swollen, the ligament will be lax for a period of time, and hopefully over weeks to months, it slowly heals. But recurrent ligamentous injuries to joints can leave a joint being unstable, right? So if we're talking about the knee joint, we'll see that if we tear certain ligaments within our knee joint, it's going to result in a very unstable knee. Okay, so really think of ligaments as providing stability to joints.